Hi, this is Dr. Jason Tirado with today's headache alert. You know, most headaches can come from many different types of causes, and a partial list can actually be things like lack of sleep, stress, allergies, maybe, and some type of neck trauma, particularly traumas that occur in sports and also traumas that occur with car accidents. You know, in most cases, the cause of headaches can actually be unknown. So, you know, a unique common denominator of headaches has to do usually with the cervical spine anatomy. And this is the lumbar spine, but I'm just going to show you this just for all practical purposes. You know, there are 7 cervical vertebrae inside the neck. And in particular, these nerves, the top 3 nerves that come out of the side of the spine, give rise to nerves that actually travel right into your head. And these are the nerves that actually share signals which can route into the brain itself. And depending upon what nerve is irritated, the location of the headache can actually vary. For example, if, let's say, C2, the greater occipital nerve, travels up to the back of the head all the way to the top of the head, right inside there. And from there, it can also communicate with another type of nerve, which is called cranial nerve 5, also known as the trigeminal nerve, and that can actually refer pain into the forehead or maybe even behind the eye. You know what I'm talking about, those people with those headaches that get right behind that eye. You get eye pain inside there. So when C1, the lesser occipital nerve, is irritated, pain can actually go from here into the back of the neck, right inside there, the back of the neck. While irritating cranial nerve 3, that's called the greater auricular nerve, that comes right around the ear. When that nerve is pinched, sometimes that can include pain and numbness, tingling, burning, itching, even aching, or a combination of these sensations just above the ear. You know, these typical types of problems where these nerves inside here get injured or get irritated are called cervicogenic headaches. And as the name implies, the origin or the pain of this actually comes from the neck itself. And you know, a 2013 study reviewed the literature of these cervicogenic headaches, and they found that manipulation and mobilization inside the neck area, that's right, manipulating these areas or even mobilizing these areas, helped decrease pain inside the neck from these cervicogenic headaches and also help overall function. And it showed that the most effective approach for treating cervicogenic headaches was not medication or steroidals or pain medications or anti-inflammatories, but the most effective approach for treating these cervicogenic headaches were actually a combination of manipulation to these vertebrae inside here, the cervical vertebrae, and neck strengthening exercises. But what about migraines, right? Migraines are terrible. I used to suffer with them before I went to a chiropractor back when I was a kid. You know, migraines are a vascular type of a headache, and some, but not all, they're preceded by some type of an aura where people actually see some type of circle before them, or maybe bright light or blurry vision. Sometimes you even get tingling or even strange smelling sensations. One study of 127 migraine sufferers reported fewer attacks and the use of less medication required by those who received chiropractic care. So chiropractic care can be really helpful for people with migraine headaches. The good news is that spinal manipulation, it's very, very safe, and a trial is often very, very rewarding for those that suffer with headaches and for many different types of headaches. That's it for now. I'm Dr. Jason Tirado with your headache alert. Take care.